I'm going to talk about low back pain. Specifically, the low back are the lumbar vertebrae. That's what we sort of classify as low back. There's 5 lumbar vertebrae. This is L5, 4, 3, 2, and 1. And you notice that the difference is that the lumbars don't have any ribs on them, so they're sitting here sort of freestanding. And why do people have so many low back issues? There can be lots of reasons for low back issues, but also you can see that these lumbar vertebrae are sitting out here without any stability, extra stability like the thoracic cage on here and the solidity of your pelvis here. But one of the big things I'm going to suggest and talk about here is one of the biggest reasons that people have lumbar pain is that we're looking at the front of the lumbars here on the inside front of the body. And one of the big deals that most people don't recognize is how much pain comes into your soft tissue that's coming from your organs. So specifically, what's attaching to our lumbar vertebrae that's going to create this? Your small intestine, our small intestine, okay, which is 22 feet long, is inside, right in here around the navel, and it's inside a fascial bag. Fascia is connective tissue that's everywhere, and every organ has fascia around it. Around the small intestine, the fascia is called mesentery. And the mesenteric bag, this mesentery that is that's kind of containing your small intestine here in the center of your abdominal cavity, what does it do? It attaches on the very front side of the right of your sacrum, and then it comes up here and attaches on the front of your L4, the front of your L3, and the side of your L2. So you have this diagonal attachment. They call it the root of the mesentery. It comes all here, sacrum, L4, L3, and here on the transverse process of L2. When you have dysfunction in your mesentery, in your small intestine, dysfunction in that will begin to pull this forward. So it actually collapses a little teeny bit your ability to stand through your low back. And instead of having your weight bearing going through L3, which this is where my weight bearing, my line of gravity should go through, now if I'm pulled forward on L3 because my mesentery has dysfunction, then what happens is that I'm bypassing L3 and I'm weight bearing into L4 and L5 when I shouldn't be. So how many people out there, in my practice, I see tremendous numbers of people with compression in the L4, L5, S1 disc. This could be one reason. I mean, somebody could have had an injury or a car accident that also creates that. But how many people are having digestive dysfunctions? How many people are having super sensitivities to different foods? 80% of my absorption of my nutrients is happening in my small intestine. So if I have some dysfunction there, if I have inflammation or bloating, which is incredibly common, then I have it pulling on my lumbar and it tightens the muscles back there and gives me pain in the muscles even though it's not coming from there. So I just wanted to make a suggestion of another way to look at low back pain. There can be other reasons for it, but this is one that's a very large reason. Okay, thanks.